I'd like to welcome everyone this evening. My name is Allison Colucci. I am a new member of the Mahwah Municipal Alliance. We are really glad that you are attending this program with us tonight. As an organization, we provide various opportunities for the community to attend programs relating to substance abuse, mental health, bullying, and cyber safety. Our goal is to help youth make better decisions and to support families in our communities as well. The Mahwah Municipal Alliance would like to thank Valley for hosting this event with us in collaboration. We appreciate Liz for assisting us during this program. She'll be checking the questions that are submitted through the chat. So if you feel comfortable submitting a question, you can submit it that way. Our presenter is also willing to share her email address. So if there's questions that you come up with or think of towards the end or once the program has concluded, she has graciously agreed to welcome any of those email questions. We're very fortunate this evening to have Nancy Graham leading us tonight. Nancy Graham is a licensed social worker. She's a professional relations representative for the RENFREW Center of Northern New Jersey, located right near us in Paramus. She's many years of experience as a mental health professional and clinician, both in New York City and in New Jersey. Since joining the RENFREW Center in 2001, she's done numerous presentations to educators, parents, students, healthcare professionals, and community organizations about eating disorders and body image issues. She also has a private practice in Bergen County, New Jersey. Without further ado, please join me in welcoming Nancy Graham.
Thank you so much, Allison. I'm so happy to be here this evening. I am going to now share my screen so that I can start my presentation. And as Allison said, please feel free to put questions in the chat. And also, I'm not sure if we will have time to get to all of them. I hope we do, but we may not because there's a lot to cover in this hour. So please feel free to reach out to me after. My email address, I will be sharing my email address with you as well as my number. So you're welcome to contact me. So tonight we are going to be talking about body image, eating disorders, all how they're connected to each other, and how we can some tips on how we can try to help those around us feel better about themselves. We also will talk a little bit about some of the common myths about eating disorders, because I think those are really important to share and to talk about, because people have a lot of misconceptions about eating disorders and body image. So with that, I will begin. So let me just, okay. So I always like to start with just a general definition of body image. I know that we all know, we have in our minds what we think of as body image, but sometimes it's a little bit different than what we think. So what body image really is our own view of ourselves. What you believe to be true about your body. So the key word there is really what you believe, because what you believe and how you see yourself may not necessarily be how others see you. Also has to do with feelings about your body. Body image is very closely connected to our feelings and emotions. Also, how we feel in our body. How we're feeling, if we're comfortable in our body, is really connected to our body image. And how do we get it? Well, actually, body image is learned. It's learned through our culture and our environment. Environment does play a large role in the shaping of our own image of our body. We are not born with body image issues or positive or negative body image. It's something that is learned throughout life. And who has it? Actually, everyone has it, right? Men, boys, girls, women, everyone has body image. And it really does directly affect our self-esteem and our general life functioning. And that's why we're talking about this tonight. So I have trouble advancing my slides here. So social media, very much connected to body image, especially now with how we are all so connected to social media. But what's that? Why does that cause a problem? Well, social media can really promote an an image that is really unattainable for most of us. Many of the images that we see on social media are not real. They're photoshopped and they're changed. We all know that, but sometimes when we are continuing to look at them, we sometimes forget that those images are really not attainable in real life. And many people take those fake photoshopped images as seriously and are really attempting to achieve the unrealistic ideal. And those folks are people who may be more susceptible to developing some severe body image issues or an eating disorder. Here are just a few examples of what we might see in magazines. I know magazines aren't that popular anymore, but certainly when we're in a store at the cash register and we see them all sitting there, it's really hard to find a cover of any type of magazine that doesn't talk about weight, dieting, and again, being skinny. The one on the right actually talks about a hunger cure, as if hunger is a bad thing. Hunger is actually something that we should be listening to and really acknowledging, not trying to resist our hunger cues and not listen to what our bodies are telling us, because that's where we can develop a serious problem. And as I said before, let's not forget about the guys. So those of you who remember the original Batman and Robin on TV, this is what they looked like. They really actually looked kind of normal, kind of like a regular guy would look. You know, they weren't over muscular. You know, they were superheroes and they had kind of strange costumes on, but their bodies really were very normal bodies. But now we have this type of bodies portrayed for Batman and Robin. And we know that this is not attainable. So when we have young kids seeing these images and trying to think that, well, I need to look like this to be a superhero or whatever it is that I want to be, it's really not attainable. So even guys and men are really subjected to these images that can really have unrealistic expectations and are not at all attainable. Those really aren't even their bodies, as we know, those are costumes. So what is the impact of all of this social media? Well, a lot of times what we see is low self-esteem. Many of the images are not real, as I said, and attaining the ideal is really virtually impossible. But if you try and you fail, that can have an impact on your self-esteem. You'll start to feel bad about yourself. People start to ask themselves, what's wrong with me? Why can't I be that size? Why can't I be that shape? Why can't I be that weight or that pretty? And I think we all can get caught up in that. When we see images of celebrities or famous people who, for example, gave birth to a child maybe 2 months ago, and already they're back to their original size. And then when we have a child, that usually doesn't happen, and probably even shouldn't happen because it's not healthy. But then we beat ourselves up and we say, well, they can do it, why can't I? Also can lead to social isolation. Low self-esteem can lead to feelings of loneliness and cause isolation when we're feeling bad about ourselves. Also, the impact can be a changing of mood, a lot of mood swings, depression, irritability, anger. Feeling inadequately really impacts our daily life and function. Dangerous extremes will then, if someone is constantly trying to obtain that thin ideal, they most likely will be using extreme measures that can lead to a serious eating disorder. We know that dieting is the main precursor to the development of an eating disorder. So when we live in a culture that's constantly talking about dieting and that pursuit of thinness, the result is seeing a lot of eating disorders. Some statistics: eating disorders, as we know, are of epidemic proportions right now in schools. And some of the recent studies have shown that the pandemic, because of the isolation of the pandemic, has caused an increase in eating disorders. We don't have a lot of studies about eating disorders, and especially pandemic ones. They haven't been published yet, but we are seeing a huge increase. Nearly half of all Americans personally know someone with an eating disorder, and probably more than half. Anorexia has the second highest mortality rate of all psychiatric illnesses, second only to opioid addiction. It's estimated that up to 20% of those with anorexia will die. So we are talking about a serious mental illness when we're talking about eating disorders, and we're going to go through a few of them during this presentation, just to familiarize yourself with the most common ones. So what is actually an eating disorder? An eating disorder is a complex mental illness characterized by extreme eating behaviors and overvaluation of shape and weight, and always has common psychological factors such as low self-esteem, perfectionism, and body image distortion. So when we are talking about an eating disorder, it is in the category of a mental illness diagnosis. What can make it more complicated and can make it very difficult to treat is that there are a lot of medical complications that can cause medical problems. So not only can it be a psychiatric diagnosis, but there can also be some medical diagnoses because of the complications that result. So the first one we'll talk about is anorexia nervosa. We all just know that usually as anorexia. And some of the things that you would see with someone who is struggling with anorexia is there's an extreme and irrational fear of becoming fat despite progressive weight loss. There's a strong determination to become increasingly thinner, and there's significant purposeful weight loss, usually in a short period of time. So it's very purposeful. So the behaviors of someone with anorexia would be very much being done for the result of losing weight, and that's the main goal for someone with anorexia. There's also a very distorted perception of body shape. Someone with anorexia will see themselves as much larger than they actually are. And that's where the whole definition that we talked about with with self-esteem before comes in. Body image comes into play, because it's really more about the perception of how you look as opposed to how you really look. There's difficulty in accurately interpreting and managing hunger and fullness cues. And there's an overemphasis on the importance of body image to self-worth. And also, we do see an abnormal hormonal functioning. We do see that a lot of the hormonal functioning is off because of what's going on with the anorexia and some of the behaviors that someone is engaging in. So bulimia is a little bit different than anorexia, because bulimia has two parts to it. It's not just restricting as with anorexia. Bulimia has recurrent episodes of binge eating, followed by episodes of compensatory purging behavior. So there's binging and purging, and you have to have both of those to be diagnosed with bulimia. And there's lots of different kinds of purging. The most common one is the self-induced vomiting. That's what we see the most. But there can also be laxative abuse. There can be diuretic abuse. And there's also excessive exercise can be used as a way to purge calories. Fasting or strict dieting can also be a part of bulimia. Dissatisfaction with body shape and weight. As I mentioned before, all the major diagnoses have that in common. There's always that dissatisfaction about bodies, and the overvaluing of weight as a basis for self-esteem. So putting so much value on weight as being you're much more worthy if you're at a certain weight. If you are over that weight, then you don't feel good about yourself. And then we have binge eating disorder. This is actually the most common eating disorder. And what binge eating disorder is really compulsive overeating that becomes out of control. There's a lot of guilt and depression that goes with binge eating disorder. So binge eating disorder is similar to bulimia in that it does have the binging piece, but there's no purging after. And the cycle for binge eating disorder is in this little diagram, you can see that it often starts with an emotional trigger, and all eating disorders are really about emotional triggers. But for binge eating disorder, the emotional trigger could occur, which causes someone to then have that urge to binge eat because it can feel better. It can be soothing. It somehow or another is making you feel better when there's emotional dysregulation. But then after that, you also after the binge, you could feel really tired, angry, and a lot of guilt, as I mentioned, with binge eating disorder, and a lot of sadness. And when you start to feel all of that, then you will say, oh, well, I'm not going to do that again. I'm going to be good, and I'm not going to binge anymore. But then there's the unmet needs, and then the emotional trigger again, and then the cycle starts all over again. So we do see that cycle quite commonly in binge eating disorder. And I also do want to point out that weight is not always an indicator of someone with binge eating disorder. Someone can have binge eating disorder and not be what we might consider obese. And there are lots of people who are obese who do not have binge eating disorder. They would not have that diagnosis. There has to be other things. It's not just dependent on weight. And it's also, I didn't mention that with bulimia and anorexia, but you actually can't consider weight for any of them. You can't look at someone and know that they have an eating disorder because of their weight. That's actually one of the common myths that we will go over later when we talk about some of the myths. This is the new kid on the block. I don't know if any of you have heard of something called ARFID. We call it ARFID. It's avoidant restrictive food intake disorder, and it's one of the newer diagnoses for eating disorders. It's a little bit different than the ones we've already spoken about. It's what, and I'll tell you why in a second, but it is still considered as an eating disorder diagnosis. It's what we used to call the extremely picky eater. There's many folks out there who are very picky. So just because you're picky and you're a picky eater doesn't mean that you have ARFID. Again, you have to have a lot of other things too. But there's actually a lack of interest in eating or in food when someone has ARFID. And the avoidance is often based on a sensory characteristic of the food. Oftentimes, someone might not like a lot of foods because of the textures. They don't like how it feels. They don't like how it feels in their mouth. There's often a concern about an aversive consequence of eating. For example, the fear of vomiting, or maybe they have had that experience with a certain food. So now that fear doesn't allow them to eat it anymore. There's usually significant weight loss or failure to achieve expected weight gain when it's in children. We look at growth charts to see if there's faltering growth to make sure that there's, that children are growing normally. And when someone has ARFID, that could be affected. And the nutritional deficiency because of that is quite obvious. There's a marked interference with psychosocial functioning. So if you can only eat one or two foods and have an aversion to many foods, obviously socially, it's going to be difficult for you to be out. You're going to become more isolated, and it won't be easy for you to be out with friends. Here's the big difference between ARFID and the other major eating disorders. There's no body image disturbance or fear of weight gain. Someone who has ARFID does not have that fear. They are not avoiding food because they want to lose weight or because they don't want to gain weight. In fact, most people with ARFID would love to put on weight. They don't want to keep losing weight. They want to enjoy foods, but there's just something that's stopping them. So it's a little bit different than other eating disorders, but it can be treated in very much like we do treat the other eating disorders. We just don't need to focus on the body image work for someone with ARFID. This is an unofficial diagnosis, but it's something that we are seeing many people experiencing. And I'm sure you can relate to this in terms of, friends and family or, people that you know. There's again, with social media and the media and all the things we're seeing out there, much of it not, fake news or, not even valid. There's a huge obsession right now and preoccupation with healthy eating and healthy nutrition. To the point where we don't really know what to believe. We hear all kinds of things all the time, and we hear different things, at different times. At one day, it's bad to eat one thing, and then it's okay. So someone with orthorexia is actually really obsessed with this, and there's a rigid following of a restrictive healthy diet, which I put healthy in quotes because a healthy diet is so subjective. Healthy diets can mean a lot of different things for a lot of different people. What that even means to me might be different what you might think of a healthy diet. But someone with orthorexia will avoid many foods because they're almost fearful of that they're not healthy and they're impure. These violations of diet really result in extreme emotional distress. There's a lot of guilt and anxiety if they do eat something that is not considered healthy or impure or clean. That's another term, clean eating. There's a lot of different variations of this, but it's oftentimes really encouraged in our culture too. It can also lead to impairments in social and vocational academic functioning, as with any eating disorder. And the physical impairments can also occur that are related to nutritional deficiencies. So we're not talking here about someone who just wants to eat healthy and eat healthy foods. We're really talking about that preoccupation, that obsessiveness that can really cause someone to almost be immobilized because they're just tremendous fear about many foods, and I can't eat that because it'll harm me. So this is something we're seeing more and more of, and unfortunately is really being reinforced, I think, by the media, by the things that we're hearing. It makes it hard to really even know, good or bad foods, for example. This is good, this is bad. When we start to label foods, it's very dangerous, because if we're labeling something good and then something bad, if we eat that thing that's bad, then we somehow we feel as though we're bad because we ate it. We try to get away from that as much as we can in eating any kind of eating disorder treatment, especially at RENFREW. We don't see foods as good or bad. We see that all foods really can fit. Because restricting them is really not healthy. So it's also important to understand and know that eating disorders are very sneaky. They're not always readily seen. Normalization of behaviors such as dieting and exercising in our culture oftentimes can really mask a very serious eating disorder. And those exercising, as I mentioned, can be very good for us and very healthy. But when you go overboard, it certainly can be dangerous. Those struggling are often functioning well in other areas of their life. They're oftentimes very high achievers, perfectionists. We always say that, many folks with eating disorders become really perfect at their eating disorder too, which is why they're so well hidden. Because it's hard sometimes to really know if someone is struggling. There's a lot of denial, secrecy, lying, and shame that often accompany eating disorders. Now, all of those words, the denial, secrecy, lying, not a word that I like to even use, and shame. Those are words that I'd like to point out, this is not purposeful. It's someone who is lying about their eating behaviors if they have an eating disorder. It's not because they're not purposefully becoming liars. Part of why they need to do this is because the eating disorder somehow is serving a purpose for them, and it's working, or at least in their mind, they think it's working. It's not, it's what really maintains an eating disorder and keeps it going. The denial is what it's, how it's helping them, because they're somehow getting something out of it. And that's in the treatment what we need to determine. We need to find out what it is that's really going on. It becomes about the food, but it's really not about the food. It's about something much deeper. So we'll quickly go through some of the eating disorder myths, because I think it's important, because many people have a lot of myths about eating disorders. The first one, you can look at someone and tell if they have an eating disorder. And as I mentioned before, absolutely not. Now, honestly, obviously, anorexia is associated with being underweight, but most people who struggle with eating disorders are really a normal weight. And even with anorexia, you have to really look at the weight that someone started at. So someone could really be struggling with anorexia, but if they started at in a larger body at a higher weight, they still could be losing weight really quickly, but are not necessarily underweight, and we might not look at them and think of them as being very thin. So it's really important to remember that just by how someone looks, we can't decide or guess that they have an eating disorder. You can battle with both anorexia and bulimia at the same time. We know that sometimes people will just be restricting and other times binging and purging. But remember that bulimia and binge eating disorder are much more common. Anorexia is the most serious one. They're all serious, but that one has the highest death rate. But they're all, they're all very serious, and they're much more common. Bulimia, and those are the two that you can less tell by looking at someone and their weight. What unites people with eating disorders is an over-evaluation of their weight and shape on their measure of self-worth. The second myth, families are to blame for eating disorders. This is an interesting one. It brings me back to when I was back in graduate school, becoming a social worker, and I remember talking really briefly about eating disorders, because eating disorders are a fairly new thing that we've even learned to understand. But at that point, I even remember somehow hearing that, well, if a young woman, because we also always thought it was women, young girls, adolescents, if they had an eating disorder, they had controlling parents. And part of it had to do with that, which we know is absolutely not true. There's no evidence that eating disorders are caused by any particular parenting style. In fact, families play a crucial role in the care, support, and recovery of people with eating disorders. There is, however, some evidence that eating disorders have a genetic basis, and people who have family members with an eating disorder may be at higher risk. But even if that's the case, there's still no blame. There's no blame in genetics. You can't help what genetics you pass down to your kids, or what genetics you've gotten from your parents. So it's not about blame. And I think that has been perpetuated throughout the years. Fortunately, we're getting away from that. But the problem with that is that I think families have oftentimes been hesitant to seek treatment for their children because they're afraid they're going to get blamed. But you should never, if you ever go somewhere and get blamed, you should never believe that or go anywhere where you're being blamed, because there's absolutely no reason for that. Genetics play a role in many illnesses, we know that. But while a person's genetics may predispose them to develop an eating disorder, it's certainly not anyone's fault. And we need to stop blaming people. Eating disorders are complex mental health issues that usually have more than one cause. We know that there's a biological basis, that's the genetic piece, there's a psychological and social. So all of those things come together in that perfect storm to cause an eating disorder. It's not just one, and it's different for everyone. It's very complex. The next one, eating disorders are lifestyle choices caused by vanity. Sorry, I left a word out. Caused by vanity and body ideals. Many people think that an eating disorder is a choice, but that's absolutely not true. No one would ever choose to have an eating disorder, just like no one would ever choose to have an addiction. It would never happen. An eating disorder, as I said, is a very serious illness. No one, oftentimes we hear that, why can't they just eat? Just eat. If you just ate, you would be fine. Well, we know that the eating disorder is not just about the food. It's not really about the food much at all. It becomes about that, but it's really not something that people will choose. It's absolutely not a choice. The fourth myth is that only women and girls have eating disorders. Well, we mentioned before, we know that that's not true. Anyone can have an eating disorder. They affect people of every age, ethnicity, social class, and gender. It's actually estimated that about 10 million males in the United States will experience an eating disorder during their lifetime. And boys and men may show different, the eating disorder may show in different ways than their female counterparts, but they have similar symptoms. We know that culturally, how boys and girls see themselves and see their bodies is very different at a very young age. For example, young kids in second, third grade, for example, if you were to ask girls and boys together, how many of you want to lose weight or be smaller? Most likely none of the boys would want to say they wanted to lose weight and be smaller, but many of the girls will. They identify with that because they know that that's what is expected and that is how they want to be. Most of the boys, if you say who wants to bulk up and get bigger, most of the boys will raise their hands for that, but most of the girls won't. So even at a young age, culturally, girls and boys already know what the expectations are. So oftentimes we'll see boys and men develop binge eating disorder more often than girls, as opposed to possibly anorexia for girls. But all genders can have any type of eating disorder. None are specific to any specific gender. Males may be more reluctant to admit the problems too, though, because of we've often thought of eating disorders only being something that females and girls and women get. So we have seen that although many men do struggle with eating disorders, they're even more hesitant to seek treatment. And in fact, many eating disorder treatment facilities historically have only treated girls and women because it was never really thought years ago that men had eating disorders, or it was very rare. So the real numbers, I think, are skewed in terms of how many. I think, we're seeing that it's much more equal. But no matter who has an eating disorder, it's important to remember that the eating disorder is an unconscious attempt to control dysregulated emotions. That's really what's at the root of an eating disorder. There's often lots of anxiety, lots of depression, a lot of trauma, and the eating becomes a way to cope with those emotions that are very difficult. It's much easier to think about food, to think about weight, to think about bodies and weight loss, than to think about your anxiety and your depression or possible trauma. It becomes what we call a coping mechanism for something much deeper. Another myth: people over 25 are too old to develop an eating disorder. Well, that's absolutely not true. We know that for a fact. First-time eating disorders can and do occur in people at any age. These illnesses are not limited to only younger ages at onset. In fact, from 1999 to 2009, hospitalizations involving eating disorders increased for all age groups, but hospitalizations for patients aged 45 to 65 increased the most, by 88%. In 2009, people over the age of 45 accounted for 25% of eating disorder-related hospitalizations. And 13% of women over age 50 engage in some eating disorder behavior. At RENFREW, we actually started a program called 30-something and Beyond several years ago, because we started to recognize that this was something that we were seeing in many women who were older. And that's also taken a while, I think, too, because I think we often think of eating disorders that it's, adolescent or teenage girls, for example. But if we're older and struggling, well, if I go for treatment, will I be the only person, that's older, and how can I relate? So it is important to really understand that women of all ages or people of all ages do experience eating disorders, and that there is specific treatment that really focuses on the unique needs of all different ages. And the last myth I think that we'll talk about is that once you have an eating disorder, you'll never get better. And that's absolutely also not true. An eating disorder certainly can take a long time to recover because they are very complex, but it is definitely possible to recover. Even people who have been struggling for many years can get better. We do know, however, that the sooner someone gets treatment when they have an eating disorder or they're struggling, the better off, which is why we always encourage parents, if they have any children who they are concerned about, to try to get help as soon as possible, because the longer someone engages in that behavior, the harder it is to break the habit. But the path to recovery can be long and challenging because it is so complex. As I mentioned earlier, there can be medical complications too that needs to be addressed. So while it's a psychological illness, there's also medical things that we need to look at. So there's a lot that needs to be addressed for someone with an eating disorder. But with support from the right team of professionals and with a high level of commitment, recovery is certainly possible. So what does treatment include for eating disorders? Well, these are not one is more important than the other, but the first one would be some type of therapy. There can be individual, group, or family sessions. Families, we need to include families as much as possible, because someone who's struggling with an eating disorder they're not isolated, they're in a family. They're oftentimes, the whole family is affected, and needs oftentimes even education to understand what's going on and what they need to do to help. Medical care, as I mentioned, we need to always assure that someone is medically stable and make sure that what's going on medically, is not being caused by something physical, a medical problem, as opposed to an eating disorder issue. We need to include nutritional counseling, meetings with a nutritionist to understand the foundation of a healthy diet. Part of the team always includes a nutritionist at RENFREW, as well as the clinician and a medical person when needed. Not everyone needs medical care, because not everyone has the severe medical problems, but if they do, we do include that. And also then there's the medications that can be used to reduce some of the symptoms of an eating disorder. There's no medication that treats an eating disorder per se. But we do see so much anxiety and so much depression, the things that we call the co-occurring conditions. Those are some of the things that we try to help our patients to stabilize those and to help them to feel better, so that they can work on their recovery and work on their eating disorder behaviors. But like I said, not everyone will need to use medications, and there's nothing really for an eating disorder. It's really for the other things that the patients are experiencing. So all of those pieces are included in any kind of eating disorder treatment. Okay, sorry, I have trouble with my... Okay, let's try. I apologize, I'm stuck here. Okay, it's essential to remember that treatment is not the same for all people with eating disorders. Everyone that comes in for treatment or that needs treatment has a different situation, different set of contributing factors, everything is different for every different person. So each person really should have treatment that's designed specifically for their symptoms, their stressors, and their supports. If someone has a very supportive family, obviously that's going to be a benefit, but not everyone does have that. So their treatment plan may be a little different. They may have to come up with other things to do to help in their recovery. So we look at each person individually. It's really important to know that not everyone is the same. And it's also important to know how to get help. As I mentioned before, remembering that reaching out, the sooner the better. The sooner you can get help, the better. And there's a lot of resources in this area, which is really, really great. Not every place has good resources. A lot of rural areas don't. One of the things that the pandemic, I think, has helped is really access to some virtual services, some virtual treatment for people who don't live close to facilities that provide treatment. We are, as I said before, RENFREW is right in Paramus. We are all throughout the country, but we do have a lot of programs right in Paramus. Our residential is in Philadelphia and Florida. So there are a lot of facilities where you can get help if needed that are close by, which is certainly an advantage. Remember that even though treatment is difficult, it can be challenging, but recovery is definitely possible. And how can I make a difference? So just a few strategies for anyone who wants to know, well, I'm concerned, what can I do? How can I make a difference for someone who might be struggling? It's really important to examine your own thoughts, attitudes, and behaviors towards your own body, particularly how these beliefs have been shaped by our society. I always like to sort of be the one when I'm amongst in a group with friends or colleagues, whatever, to sort of be the one to start to challenge some of the things that I hear and things that I hear people saying and doing. Talking about dieting all the time, the conversation goes to that so often when we're amongst friends and family and anywhere. And, oh, I shouldn't eat that. I should be losing weight, or I'm on a diet, or, oh, I don't look like how I look today. That what I call bad body talk. Conversations go to that all the time. And I think if we could be the ones to turn that around and say, wow, why are we talking about this? It's not helpful. It doesn't help us feel better. Let's start to be more positive and focus on the things that really matter, not things that are not all that important. And just remembering that our children really listen and they hear the things that we say and do. We hear a lot of that from our patients of, hearing about family members who are constantly dieting and putting their own bodies down. And they pick up on that. They think that that's what they need to be doing. And they oftentimes do mimic what we say and do. So just being aware of that, I think, and being more conscious of that conversation that I think really happens more often than when we start to be aware of it and, be mindful of it. Closely examining dreams and goals for yourself and your loved ones. Are you overemphasizing appearance and body shape? I think way too often we do think that, well, if we look a certain way, we'll be more successful. And our society does, reinforce that. We know that people do judge others on how they look. Weight, for example, there's been many studies that show that we judge people and we have preconceived ideas about people's personalities just by how they look and how much they weigh. Who hasn't heard that, if someone is in a larger body that, oh, they must be lazy, which has nothing to do with their bodies, but we assume that. Or if someone is very thin and looks a certain way and is very attractive, oh, they must be happy, or maybe they must be successful. That's not necessarily true, but we assume that. We oftentimes make many assumptions based on appearance and shape. Remember and discuss the dangers of trying to alter one's body shape through dieting or extreme exercising. We tend to really do this a lot in our culture, always trying to exercise to change our bodies, and it can really lead to some dangerous behaviors. And exercise really should not be to change our bodies as much as to make us feel better, to make the commitment to exercise for the joy of feeling your body move and grow stronger, not just to purge fat or with the goal of obtaining a perfect body. Because what even is the perfect body? Who even determines what that is? There is no such thing as a perfect body. And even if there was, why is that even necessary? What good does that do? It doesn't make you successful. It doesn't make you happy. I mean, it might make you happier somewhat for a while, but it's not really those things that are important in life. There are so many other things that are more important for your success. Appreciate the genetic basis for the natural diversity of human body shapes and sizes. I think we're starting to see more diversity in advertising and, different body shapes and sizes, which is great. And appreciating that. If all of us looked exactly the same, how boring would that be? It would be, I think that's what makes us unique and special, is that we are different. We are different sizes and shapes, and that's what makes us very special. If we all looked exactly the same, it would be very boring. And making a commitment, this is a hard one, making a commitment not to avoid activities such as swimming, simply because they call attention to your body. I like this ad. I have swimsuit confidence. I mean, who of us out there, women, I mean, I don't know who's out there, but I can speak as a woman, hasn't many times thought to themselves, oh no, now I have to put a bathing suit on, or now I have to go and try on bathing suits and dread that, and maybe even avoid it because of that. And maybe says, oh, I'm just not going to go swimming because I don't want to put a bathing suit on because I don't like how I look. But if you think about that, it's so sad, because why should we avoid something that we like and enjoy, that brings us pleasure, just because we're worried about how we look in a bathing suit? It's quite sad that we do that, but I'm sure you all can relate to that. I can too. I mean, it can be an unpleasant experience because we worry too much about that. And we waste so much time avoiding activities in our lifetime that we could be enjoying. And then life is short, and so we're not enjoying it. So why not make that commitment to let ourselves enjoy what we want to do and not worry about how we look and our appearance? Acknowledge and resist the ways that the media distorts the true diversity of human body types. I mean, we all know about photoshopping. We all know about all the filters that people are using on social media, on all of their social media. They're changing how they look, and they won't post a picture unless they make themselves look perfect. But when we do that, we don't embrace our real selves. We actually don't allow ourselves to accept ourselves who we are, or accept that we are all different and special. Practice taking people seriously for what they say, feel, and do, rather than how thin they are. It's so unimportant how thin somebody is. Success is liking yourself, as Maya Angelou said, liking what you do and liking how you do it. I don't think she worried too much about what she looked like or how, what she weighed. I think it was so much more important for her to value other things. And I think if we could start to do that and not worry so much about what we weigh, because when it's all said and done, it doesn't really matter what we weigh, does it? And if that's what we're going to be remembered for, it's kind of sad. I think we all have so much more to contribute and to be remembered by than what we looked like and how much we weighed. And be aware of the various forms of prejudice. And one of them is weightism. We have tremendous weightism issues in our culture. We do judge people terribly by their weight and put them down, and encourage everyone's responsibility for preventing them. And if we hear that happening, tell people, mention it, and just say, that's, we shouldn't be doing that. It's not something that we should be judging people on. It really just the whole culture that does that is just a really negative, and it does affect people's self-esteem. It does. We have many patients who can remember that someone said something to them that hurt, and they just, that just spiraled them right down into the eating disorder, because that felt so bad. So be aware of that, and just try not to let it happen if you can help it. And let's see here. Setting realistic goals. Set achievable, realistic goals by focusing on who you are rather than how you look. And with that, I finish so that we do have some time, hopefully, for questions.
Hi, yes, we've had a few questions come in.
Okay, great.
Let's see. I'm going to combine a couple of them.
Okay.
So, do you have outpatient services, and do you work with breast cancer survivors? I guess estrogen blocking pills and having problems with extra belly fat.
Okay. We do have outpatient services. I really didn't want to take a lot of time. I probably should have talked a little bit about RENFREW, but we do have, we do work just with the higher levels of care. So, and only there has to be an eating disorder diagnosis to come to RENFREW. But we do have day treatment and IOP and residential. All of those other pieces that you mentioned are that belly fat from any kind of medication is a medical, that's something that people do struggle with, but that's not an eating disorder. Okay. There are lots of side effects to different medications that can cause someone to have their bodies change. We know that. It certainly can lead to helping you not feel good about how you look, but the focus should much more be on the benefits medically, and am I medically healthy? And if I'm medically healthy and I'm able to live life to its fullest and be healthy, it shouldn't matter if we have a little belly fat. And that's kind of what I was saying at the end there. It's like, that should not be important if we can live a full life and be physically healthy. And if that's the side effect, I guess to me, it's worth it. So all of those other things would really be more medical issues that need to be addressed, not eating disorder issues necessarily. I don't know if I answered the question, because I wasn't quite sure what that.
Well, I'll let I can tell this person that they can email me, elucas@valleyhealth.com, and I can put her in touch with some folks at Valley who might be able to assist.
Right.
Okay, our next question is, do people with eating disorders tend to be more passive or less aggressive than the average person in their community?
Not always. It could be. It really varies for every person. Really varies. We see some people who are very active and very involved, and are still struggling with an eating disorder. I think that really has more to do with the individual personality of the person. While I mentioned before that there are some, that we do see a lot of perfectionism, and there are some traits that we seem to see more of, but that doesn't mean that there are the people who are not overachievers and perfectionists, they can still struggle with an eating disorder. So those are just some of the more common things. So we don't generalize. I mean, it really can affect anyone. So, yeah, so we don't really know. Like I said, that's what makes it difficult. It's hard to know who will develop an eating disorder, because we can't say it's definitely, someone with A, B, C, and D. It really varies across the board.
Okay, how do you talk to a teen that may be suffering from BDD, thin and seeing themselves as fat and wearing oversized clothes to hide the body?
Well, what we like to say to folks is that we try to stay away from the body, which is hard. We try not to focus on the weight and body, because all bodies are different and beautiful in their own ways. But especially with binge eating disorder, there is oftentimes a real underlying depression that is being masked oftentimes. So what we often suggest, and I'll reinforce or say again, if anyone ever wants to reach out to me after this and talk about any specific situation, you're welcome to do that. I'm happy to talk about that with you and help you. However I can. But we recommend that you focus really on the emotional piece, because talking about, we don't want to focus on weight and size and shape. We want to focus on, gee, you seem unhappy. You seem a little sad. You seem kind of depressed. Is there something going on? Like, I feel like you're a little withdrawn. You don't seem like you're going out with your friends as much. Focusing on the behaviors and the emotional piece, because that's the piece that is causing someone to either usually overeat or undereat or whatever. So focusing on that and addressing that somehow. For teenagers, it's hard because they're oftentimes not going to want to talk about it. Sometimes just getting them someone to talk to, a therapist, a counselor, even a dietitian can be helpful. I want to just advise, though, to be careful with getting a dietitian. I would recommend making sure you're finding a dietitian who knows eating disorders, because there's too much focus on diet and weight loss, especially for teenagers who are considered overweight and might be struggling with that. We tend to just say, oh, just go exercise and go on a diet. And that can maybe be the worst thing you can say to someone who might be struggling or beginning an eating disorder. So making sure that they're working with someone who knows eating disorders and can really focus on it in a different way. But focusing really on the feelings, the emotions, the affect, much more than the weight, and acknowledging how hard it is when you are feeling, oftentimes folks like that are being bullied and, being, taunted or whatever. So oftentimes, that's very hard for them too. So that reinforces the depression. So I think dealing with that piece more than the weight.
I think that kind of ties into the next question a little bit, is doctors today, they base everything on BMI, and BMI is very hard to obtain. So are doctors contributing to our obsession with weight?
Well, obviously my answer will be my opinion, but yes, my opinion is yes, they absolutely are. Because, listen, we know that diets it's not working. Putting people on diets, we just know if that worked, then people would just go on diets and everyone would be a healthy weight, whatever a healthy weight even is. So absolutely they are, because it's, oftentimes they're looking at the medical piece, which oftentimes is not even, there's a lot of statistics now and studies showing that being overweight, obviously not morbidly obese, but being somewhat overweight is not as unhealthy as we used to think it is. I think we put too much emphasis on, that a certain weight equals health. I mean, if you look at the perfect examples for me are Venus and Serena Williams. Their whole lives they've been made fun of and, oftentimes put down because of their bodies and their sizes and how, they're considered to be larger. And look at how strong these women are, and they're amazing athletes, but yet they've had to endure constant, criticism, which is ridiculous. That's how their bodies are. But we just don't value that in our culture. So I do agree that doctors are definitely reinforcing it. And we struggle with finding doctors. We have patients who have been told horrible things by their doctors. That's just made their eating disorder worse. So if anyone is experiencing that with a physician that is saying things that are reinforcing and making it worse, you can, I mean, I don't know a lot of I know more pediatricians than general practitioners that are pretty good at not reinforcing that are tuned into it, but they're not even trained in eating disorders in medical school, by the way. So it's not always their fault. But yeah, their focus is so much on weight and BMI. It's unfortunate. you know, and it hasn't helped. I mean, we're not as a society, I think we need to stand back and say, like, wait a minute, this whole war on obesity, you know, it certainly isn't working, because we're just getting, you know, people are getting heavier and heavier. So let's look at this and say, maybe this isn't the way to go. Maybe this is not, you know, we need to start to think of a different way to look at it.
Well, how does one go about getting a diagnosis to then get treatment?
We do a full evaluation first before someone will come to us for treatment. So if someone suspects or feels as though they may need treatment, or a family member may need treatment, there are certain criteria that needs to be met, you know, in order to get different diagnoses, the diagnostic criteria, obviously. But you could schedule an assessment with us at RENFREW. Now, we only do the higher levels of care. So, but there are therapists who also, you know, it would be good to maybe start with an individual therapist or a nutritionist who knows eating disorders, who would know if you needed more than just the individual therapy. Because not everyone needs higher levels of care. Many people can, you know, can get treatment individually and outpatient treatment. So you have to have that assessment to meet that certain criteria for the different levels of care. And not everyone needs to go into residential treatment, for sure. We have day treatment, we have IOP. I didn't spend time, I don't want to spend time talking about that. If you're concerned about someone in particular, again, feel free to reach out to me. We can talk about it. You can give me a little more information. It will be confidential, and I can certainly give you my opinion and let you know if I think this might be someone who would benefit from treatment.
And what's the best way to answer this question from a teenager? Am I fat? Please be honest with me.
That's a tough one.
Yeah.
That's a really tough one. Oh, that the problem is that what does that even mean? And I hear so many things. If I heard a teenager say that, I mean, it's a whole discussion for me in terms of, obviously, I mean, if we think about even ourselves, one day I can look in the mirror and probably, if I'm feeling good emotionally and I'm really happy and I'm excited about the day because something good is happening, I'm probably not going to look in the mirror and say, oh, I look fat. But another day when I'm upset and unhappy, I might look in the mirror and my same body, I might feel like I look fat. So to me, when someone is saying that, it signifies that they're feeling bad about themselves, that they're feeling unhappy, they're not liking themselves, which is translating into they're not liking their bodies. So there's something much more going on. So again, there's no simple answer to that, unfortunately. I might say something like, it sounds like you're not feeling good about what's something today, or you're not liking how you look today, or you're feeling bad about yourself today. Is something going on? Trying to open up the conversation and getting away from the fat, but understanding that it's they're feeling really bad about something. It's not so easy. It's not something you can just answer once either. It's an ongoing conversation. If a teenager's feeling like that, then I think there's something that the discussion could continue in terms of feeling unhappy, or maybe somebody said, you're fat. Could be as simple as that. Maybe somebody said, oh, you're so fat. And then they need reassurance. And it also, I think, does depend on their body shape and size too, because some kids do struggle with weight. And if it's someone who's struggling with weight, that discussion is going to be more about how can we help you move forward to feel better about yourself, and what can we do? Can we maybe take more walks or start doing things, and maybe we can together work on, healthier snacks or things, that type of thing. But if they're not fat and they're not, and that's not at all, that's a whole nother issue. You don't want to focus on that. It's very complicated. I know. I'm sorry that I don't have a good answer for that.
Now we have time for one more question, and that is, I may have missed it because I had to step away twice, but I've heard eating disorders are a way to, quote unquote, have control. not as in your family had control over you, but it is
Mhm.
something you can control. Is it more anxiety related in this instance?
We do often say, and it is an unconscious way for us to feel in control of something when most likely we're feeling out of control. Like we have a lot of things aren't going well in our lives. We're depressed, we're anxious. We have, family, our parents are, getting divorced and we're really upset and we have no control over that. So somehow we switch to, well, I'm just going to start dieting and losing weight and all that and focus on food and exercise. And I won't have to think about the things that are really painful to think about. So yes, that was a real quick explanation about how it's our unconscious way of gaining control. We can control our weight, we can control our food, we can focus on that to the point where we can tune out all the other things that are too painful. So yes, it is in some ways about control. It's not a conscious choice. It happens somehow for many people, and it works, and that's why they don't want to give it up, because giving it up means having to really address what the emotions that are very, very painful sometimes. If it was trauma, or it doesn't even have to be something serious, but something that's painful for us that we don't want to face. It's also why folks with eating disorders will oftentimes regress back into an eating disorder during times of stress in their lives, because it's a coping mechanism. It helps soothe them. They don't have to think about what's going on. If it's something, a patient that I used to speak with me, she was in recovery and doing really well, but then her father got really sick and they thought he might die. She went right back to her eating disorder during that time because it was too hard for her to think of that. And she was really comfortable with the eating disorder and it helped her feel better somehow. Unfortunately, it causes a lot of other problems too. So it becomes the go-to way to cope with stress, which is why someone needs really a lot of help and work learning better ways to cope with stress, not through an eating disorder. So that's how it's all connected to control, if that makes sense, I hope.
Great.